Let's keep it in the KUAM News Zoom room, shall we? On the link coming up, we got Lacia Casil to talk a little bit about Equality Guam. There is an event that's happening, I want to say, this weekend.
Yes, tomorrow.
Yeah, tomorrow. I told you it's this weekend, tomorrow. 9:42. We'll go into the Zoom room now where we're going to get public health PIO, Janela Carrera. Thanks so much for joining us, Janela.
Hi, thanks, Chris. Thanks, Bree. Thanks for having me on.
I guess we wanted to kind of start with village-based vaccine clinics, homebound efforts, and drive-through testing results. So if you could just want to go down the line on those.
Sure. Yeah. First, I just want to, I know you guys just had Captain Mark Scott on talking about the UOG Fieldhouse operations with vaccination clinics. And so I just want to extend my gratitude to the Guam National Guard for assisting us. That's a pretty large operation. So, and they're doing a great job with that. But also, we continue to have our village-based vaccination as well. We kind of call it our mini pod because we go out to the villages and we offer vaccinations there. About 100 vaccines or doses that we offer to the villages. So today we're in the village of Agate, and the next week, Monday, we'll be in Santa Rita, Tuesday in Jonya, and then next week, Friday, we'll be in Barrigada. We ask that those who are seeking a dose, first dose, or second dose, that they get registered with their village mayors. That way we can prioritize, of course, those who are registered, but we do accept walk-ins as well. We are also continuing our homebound vaccination efforts in those same villages. So if we're having a village-based vaccination clinic in Agate on Monday, then we also have a homebound team that will be going out to that same village in Agate, and they'll be vaccinating those who are homebound as well in Agate. And then same goes in Santa Rita, we'll be doing a mini vaccination clinic in Santa Rita, and then we'll have a team that will be doing homebound vaccination in Santa Rita, and then Jonya and Barrigada. So we kind of mirror the village to the homebound vaccination. That way we kind of just have one team doing one village and then another team doing that same village. And it's kind of all together in one village. So far, all combined with our vaccination, homebound vaccination and our village-based vaccination, we've done about 810 people so far since we started this combined effort. So we're really, very proud of our efforts so far, and we're going to continue to do this. And then as far as yesterday, when we did our drive-through testing in Jonya, we did 126 swabs or samples collected. And of that, 125 were negative, and we had one positive case.
Wow. I wanted to ask Janela, because we had Dr. Ann on earlier, and she talked about issues with the vaccine supply chain. And so I was able to ask a few sources, and they were saying, I don't want to blindside you here, but are there any issues with public health being short over 800 doses for Moderna, shot number 2 for February? Is that kind of what's happening with the supply chain? Are you able to say?
I'm not too familiar with what our inventory is looking like, but I do know that when, the vaccine committee met, and there is discussion that they want to prioritize those who are due for dose 2. The good news is our supply for the month of March is increasing. And in fact, we were allocated an increase for the month of February, but we will be receiving it in the month of March. But as far as our inventory for the month of February, I'm not too familiar with what we're looking at, but I do know that we do want to prioritize those who are due for dose 2. And so that is what we are doing. But again, we have a schedule for those in the homebound and also for those in the village-based vaccination, we are sticking with that. So we have Agate, Santa Rita, Jonia, Barrigada, 100 doses allocated for each day, and we're going to continue with that. We have, of course, at the UOG vaccination clinic, doses that are allocated for those clinics. We are going to stick with that. So it's not like, at this point, we're reducing any of the allocations. But at this point, I'm not too sure what the inventory is looking like.
Well, it kind of sounds like you guys just juggle what you do have and prioritize who needs it first, right? So, for example, the second shot people.
Right. So if you are due for your second dose, we are going to ensure that those who are due for dose 2 will be prioritized.
I know that you guys kind of have the community drive-through testing. It seems like on a weekly basis. Will there be one next week?
That is a goal. We are trying to do at least once a week, and so far we've been pretty. We've been meeting our goal in doing that. So we're gonna, meet again and discuss plans for another drive-through testing for next week. We need to identify a location. The village of Jonia, the mayor was asking for one in his village, so we obliged. We did one in Jonia. So now we want to look at what area or what village we'll have one next week. So hopefully we will make that announcement pretty soon. We want to try to make the announcement as early as possible to give residents time to prepare and be aware of where that location is going to be. Something we did a little differently this time around this week was we actually passed out some flyers in the village where the testing was going to occur. And I think that actually helped to increase some awareness. So yesterday we had a really good turnout. We never saw the line stop. There were cars flowing at every minute. I was in a position yesterday where I could see my line of sight. I could see the cars coming in, and not once did I ever see there not a car driving in. So we were very happy with the turnout yesterday. And I think we're going to continue that type of effort where we'll pass out flyers in the village where we're going to be at. And hopefully that will continue to raise awareness about our community testing efforts.
Right. And it goes hand in hand with, I guess, the effort to, continue to contain COVID. Just because the vaccine is here, right? We all still need to be vigilant in everything that we do.
Definitely.
So thanks and kudos to public health.
Amen.
Really.
Thank you. We appreciate that.
That's it?
Yeah.
Okay.
Yeah.
Thank you, Janela, for coming on.
Thanks for having me.
Take care.
Yeah. Have a great weekend.
You too.
Okay.